Good afternoon. Thank you for joining us with the Ventura County COVID-19 update. My name is Kelly Long. I'm your Ventura County Board Chair and District 3 representative. On behalf of all of our Board of Supervisors, I would like to just say thank you for washing your hands, social distancing, and staying social distance so that we're not doing our gatherings. Yesterday we had a very long update of our COVID-19 information. I'd like everyone to go to ventura.org/BOS. You can watch all of the information there. But today we're going to be hitting on a couple of different items. First, I'd like to congratulate Supervisor Bennett, now Assembly Member Bennett, for being sworn in for the Assembly, and also to welcome Supervisor Matt Levere, who has now been appointed by the Governor to be on our board. On January 12th, we will be swearing in Supervisor Ramirez, Supervisor Levere, and myself as our 4-year term will be starting. Today we have a lot of great information. One, playgrounds have been announced by the state as being opened. I know your kids, my kids, are going to be very happy about that. We have a frequently asked questions on our VenturaCountyRecovers.com, and you can also go there for testing information, how long a certain area has, long as a testing has maybe 45 minutes or 3 hours. You can see what testing facilities are open and what the wait time is. Sorry, a little tongue-tied there. We also have guidelines, so if you are a business, if you want to make sure you're following the right guidelines, all that information is at that location. Thank you to our Board of Supervisors. Yesterday, Ventura County voted to send a letter to Governor Newsom in regards to a coastal region for SLO, which is San Luis Obispo, Santa Barbara, and Ventura County. The other 2 counties also voted to send a letter to Gavin Newsom to do the regional approach in our coastal region. And so I'd like to say thank you very much to Greg Hart, our chair of Santa Barbara and his board, and also Lynn Compton, the San Luis Obispo board chair and theirs, also their CEOs and their public health directors. This is a really team effect. Team approach to make sure that we're using as best common sense as possible to care for the community and also keep our businesses open and educate our kids. It's very crucial that we are nimble, and we believe that having these 3 counties working together versus the entire Southern California region, we can better treat, better activate our community, and really just get people to buy in on the fact that we need to be slowing the COVID-19 down. We need to not spread. And so we believe that it is extremely important to have this coastal region connected instead of the entire 23 million. We'll be having 1.5 million people in which we are really working on. So thank you so much. The letter was sent out yesterday. Thank you to the news and all the people for advocating for this. Our businesses are advocating, our families, our cities are advocating as well, and just appreciate everyone coming together for the good of our communities. Also, heavy winds right now. As you saw, we've had 3 fires in the last 3 days and lots of power shortages. So if you need any information on the fires, on the heavy winds, go to vcemergency.com. The information for how to talk to your electric company, SCE, is on there. Also to go to vcfd.com to get the latest information on fires. Appreciate everyone listening in and tuning into our social media. We've had evacuations, we've had our sheriffs out, our fire department, and thank all of them for the great work that they're doing. Without them, we would not be as safe as we are in this unprecedented time. having a COVID-19 where we're staying home, and then power shutoffs where you're trying to work at home and educate and you have no power, to fires in your area and you're being evacuated is a lot for our community. And so again, you've got to agree with me that the regional coastal region coming together is a really smart decision for us. So please remind you to sign up to VC Alert for all the activity that's going on in our county. And then also, we're going to update you on our public health. As you know, we are not, we have COVID-19 here. We're not saying we don't, but we need to make sure that we're doing everything we can. And we're going to have Rigo Vargas, our public health director, talk to you about that. We're going to have Dr. Theresa Cho of Ambulatory Care talk to you about preventative health and telehealth, how to make sure that you stay healthy, exercise, and get what you need for prescriptions and so forth. We have Dr. John Fankhauser, who's going to talk to you. He's our CEO of Ventura County Hospital for both VCMC and Santa Paula. He's going to talk to you about our hospital situation, testing, vaccines. Then we'll have Mike Powers, our CEO, cover over some other items in regards to the county. We really are a team here in Ventura County trying to cover all the different things that we need to for your needs. And so we just ask you to really help us by making sure that we're not spreading the COVID and that we can keep our businesses open and our kids getting educated. It's extremely important. It's a teamwork for all of us, so I just really appreciate and urge you all to wash your hands, put your mask on, and social distance. We have Christmas coming, we have Hanukkah coming, and we really just urge you all to not social gather. I know it's really hard, but do a Zoom call. Order them something from a local business and send cheer that way. Anything we can do to just stop it, we'd really appreciate it. So with that, I will have Rigo Vargas come up from our public health director. And if you could please bring the wipes. I notice we don't have any and I want to make sure we're clean. I'll put my mask on. Okay, so again, thank you so much. If you go places, use a wipe, put a mask on, social distance, and really appreciate it. Rigo, thank you very much. And until next time.
Thank you, Chair Long. Good afternoon, Ventura County. So I'm here to provide you with a usual update and share some words regarding our current situation. First, in terms of our numbers, I believe you can see on the screen our current metrics, and those indicate that the surge is very well present, real, and concerning in Ventura County. First, with our usual number of reporting case rates, our number adjusted is 25.6. Our true actual case rate is 34, and usually, actually, we've been getting a half a point reduction for everyone for every case rate. And so, last week, based on our testing volume, our number went from 31 to about 15.5. And so you might say, what happened from last week to this week? Why did it go from 15 to 25? Well, it has to do with the testing volume adjustment factor that the state builds in. And as we've shared with the public before, we've had concerns. We repeatedly share those concerns with the state. We urge them to have one stable test volume threshold for all of the state so that the adjustment factor does not vary so much. And so again, for the last 3 or so weeks, our adjusted case rate would be half of our actual. This time it went still significant drop, but not the half drop. It went from 34 to 25. Bottom line is this. Our cases continue to increase. We're still in the middle of a pandemic, of a surge. We have not flattened the curve, and so it is very concerning. And with that, we, of course, always urge everyone to practice all that we've been aware of and recommending and that we're all very familiar with. Wear your mask, at all times, especially when you're not able to social distance. Wash your hands regularly, get tested, and social distance. Do not gather. Right now with the current stay-at-home order, the 3 household gathering is not allowed, is not in effect. Please limit further your gatherings, and only then will we be seeing improved case rates. Also, back to the slide, our other numbers that are very important for once we flatten the curve for us to move out of the current purple tier. And so that is a positivity rate. The positivity rate also has increased, I would say, significantly, dramatically the last few weeks that we've been in this surge. And so you see now that it's 7.8. We used to be around 4 when we had it at a much improved number. And our health equity metric that is an indicator of the case rate, but also the percent people that are getting positive results in our low-income, higher density communities, and that number has also dramatically increased to now 11.6. It was also very low number that, in fact, both positivity numbers for the general population and the health equity areas, we were in the 3rd tier, the orange tier. But now, again, we are seeing these increases, and these numbers are which are very concerning. And that brings me to the last number on the top row on your right-hand side. You see that for the Southern California region, we are at 9% ICU capacity as measured by the state, and relating to adult ICU bed capacity at 9% for the Southern California region that we currently are in. Your Ventura County hospitals are awesome in terms of planning, including surge planning. Right now, our number is higher than the Southern California region, and that is at 11.4. And I believe the state current number is 11.6. So we are right with in alignment with the statewide average for ICU beds, and in fact doing a little bit better than our large current Southern California region. These numbers change clearly on a daily basis. We have regular communication with our fabulous partners in the hospitals, all 8 hospitals, and so you'll hear more about efforts to continue to improve adult bed capacity, as it is now an important number. Not only has it been always as an indicator of the seriousness of COVID in our communities, but now it's also important for us to, after the minimum 3-day current stay-at-home order, this number is going to be very important for us to be able to exit the current stay-at-home order, and that relates back to the information that Supervisor Long mentioned, which is we're trying to urge the state to grant our request for us to form our own region for when it comes to exiting the stay-at-home order. It does not change things. It's not that we're not saying that we're not going to abide by the stay-at-home order. It does not mean that all the current collaboration that takes place with our counties up north and down south with regard to sharing of resources and transferring of patients as needed, that is not what the actions that took place yesterday are about. It's all about the exit strategy, so that our communities in the tri-counties, given that we're smaller, that we have a history of strong collaboration, that when our numbers improve, that then the state looks at our hospital capacity for the tri-counties, looks at our positivity rate, our case rate, and we believe that if doing so, we'll be able to better serve our businesses, our schools, and our entire community, and be able to get back on track and do some movement and improvements in our tiers, and not necessarily stay in the current larger region that we believe, because of the size of our sister counties in the south, that we might be a little bit longer in the stay-at-home order than would be otherwise needed or necessary. So more to come on that. We hope to hear back officially from the state, but clearly, again, even if they grant it, it's not any action that would take into effect prior to the 3-week minimum that we're all urging Ventura County residents to abide by. I'll go over now next our rates, our numbers for today. If maybe is it on the screen? Yes, thank you. So these are our numbers for today. So they continue to show that our community is greatly impacted by the current surge. We are reporting 170 new cases. These are cases I was asked to clarify and to confirm that these are new tests, newly tested positive individuals. It does not mean that all 170 have symptoms, but what it is doing, it's catching the disease so that we can work with these 170 individuals, whether they have symptoms or not, because as you know, COVID is and can be spread from asymptomatic individuals, those that don't have symptoms. So it's very important for everyone to know, get tested and know if at that time of their test, if you're positive or not, so that if you are positive, even without symptoms, that you take extra caution, isolate yourself and not infect others. That's why it's so important to get tested, even if, again, these individuals do not have symptoms. We're also reporting 147 currently hospitalized in our 8 hospitals. You'll hear more about that by our CEO from our county system of hospitals. There's 42 collectively among the 8 hospitals in the ICU unit. Unfortunately, this is another record high, both in terms of number of COVID individuals that are sick enough to have been admitted to a hospital, and then 42 that are serious enough, their illnesses, that they are in the ICU unit. Both of these numbers are, again, unfortunately at a record high, and so our hearts, thoughts are out with these families for a swift recovery. And I'd be remiss if I didn't take this chance to also thank the wonderful hospital personnel that are treating for now, 9 months, 24/7 individuals that have been affected by COVID. They are working extra long hours, and so when people at times try to minimize the impact of COVID, I urge you to really think about these hospital workers that are exhausted, but yet providing excellent care for all these individuals. And so please keep them in mind when we act and act responsibly with regard to mask wearing, hand washing, social distancing. Keep in mind our exhausted but wonderful hospital workers, as well as other folks in our department, many other departments that are working around the clock to try to flatten the curve. And it's going to take a collective action of everyone, including residents, to flatten the curve. Lastly, I want to point out in terms of these numbers, draw your attention to the number of new deaths. It's very unfortunate, as we've said before, that first, when we see a surge, we see an increased number of cases, followed by a number of individuals that need hospital attention, then followed by a surge in the number of individuals that are in the hospital that need ICU care, and ultimately and finally and unfortunately is what follows is an increase in number of deaths. And so for the last 7 days or so, we've had very unfortunate reporting almost on a daily basis of additional deaths. And a reminder on that it's not all deaths among folks that have comorbidities. It's not all seniors, and even if they're seniors and have a comorbidity, COVID has worsened their conditions, and they have left their families. They have passed away prematurely because of COVID. So it is a serious health issue that we should all be concerned about. On a positive note, 2 things. Our testing volume, while we're not getting the same adjustment factor, continues to be very strong. And so our capacity and our testing volume are both very strong. And so today we're reporting 1,638 newly Ventura County residents tested. Also on a positive note is that the vaccine is around the corner. It is going to come in phases and in stages with because of limited amounts early on. It's going to be phased in a staged approach with priority populations that start with what I referenced earlier, our brave, admirable hospital workers that are providing direct care. They'll be the first ones in line to get the vaccine, and so will be the long-term care facility staff that are also providing excellent care to those most vulnerable. So those are the first 2 groups that as early as middle next week, we expect to have the vaccine made available for those staff. After that, it will be other vulnerable groups eventually, but most likely until next year around springtime do we expect enough quantities for mass vaccination of all residents. That's the expected timeline. So nevertheless, the vaccine is expected with high efficacy rates. We believe it'll be very effective. We encourage everyone, once offered, that they'll take the vaccine, get vaccinated, and so with the continued vaccination improvements and also with the abiding of the current stay-at-home orders by everyone, with those two actions, we believe we will turn the corner soon enough. But right now, we have not even begun to flatten the curve. So with more reason, again, please keep in mind our businesses that are being severely impacted, children that are still not back in school. And we know that it's been so hard with our hospital and other workers. And so for those reasons, keep them in mind as you not gather with those outside of your household, as you wear your mask diligently, and as you wash your hands frequently. So with that, I'll conclude my remarks. And next, I'd like to introduce you to Dr. Theresa Cho. She's the CEO of our ambulatory care system.
Thank you, Rigo. I'm Theresa Cho. I am a family physician, and I am the CEO of the Ambulatory Care Clinics of the County of Ventura. As a family physician, one of the most important things that I do, along with all primary care providers, is to provide preventive health. And what that really means is offering screening and detecting and intervention before chronic illness or serious illness occurs. I know we're in the middle of a pandemic. I know there's a lot on your minds, but I just want to call some attention to the importance of preventive health, despite the fact that we have all of the challenges. Preventive health is how, again, you would get testing or screening from your physician or provider at a clinic. And I know that with the pandemic, we have not really addressed that as we have in the past. So the American Medical Association has been keeping statistics on this and has found that childhood vaccinations are down by 60%. Colonoscopies are down by 90%, mammograms and pap smears down by 80%. So if you look at the months of March and April, we had some serious decline in our preventive health efforts. Now, some of that has come up, and we now are seeing some improvement in access to that preventive health care. But those are serious problems that might present as cancers or other illnesses a year from now or down the line. And I think that those are things that we want to prevent and want to kind of talk you through how you would safely get preventive health care even in the time of a pandemic. So we're 9 months into this pandemic, and so the first thing I would want to say to all of you is don't wait. Don't wait to get your preventive health care. I know many of us are thinking, oh, this will be over in a few months. I'll go get my health care when this is done. But as you know, this has been a marathon, and we don't want you to wait any longer. We really want you to stay connected to your provider so that you can get care for preventive health and also your other chronic medical problems. So to that end, I want to just outline that every clinic at the county has telehealth. So what is telehealth? Telehealth is when you connect with your provider, either through a video conference or through a phone call. Either one of those is fine. And what it allows us to do is to address your health concerns, maybe even review what you might be due for preventive health, because you might not remember whether you're due for the pap smear or not, and connect you to that provider who can review your medical record and figure out what it is you need. So we know that it's not the same thing as an in-person visit, and we as physicians really want to see you face-to-face as well. But given the current circumstances, it's really one of the safest ways to really address your concerns without having people too close together or in a risk, an exposure situation. So again, don't wait. I want to talk about some other ways that we can test and screen for preventive health issues without even having to be in the clinic, for instance. So one thing is get vaccinated. Get vaccinated for flu. We know that if you get the flu, you are going to be more susceptible to complications if you were to also get COVID. So you want to make sure that you have your flu vaccine. And to that end, I would point out that the county clinics have drive-up or drive-through options for the vaccine, meaning that you can stay in your car and a nurse will come out and actually vaccinate you without you having even to come into the building. So if you're not sure where to get that, please call one of the county clinics and they will direct you to when they are having those community flu events and where you can drive up or drive through. The other thing I want to point out is for colon cancer screening, for example, instead of a procedure, you could use a card called a FIT card. You can use that at home to test and send that in. And what we would do is look for any risk for colon cancer. Now, if you had a positive test, we would be able to expedite and have you have the procedure that you need to see if there really is a concern or not. I also want to point out that these are difficult times. I know that just being in quarantine and having the surge come back again has put people into a place where maybe they feel more isolated. So mental health struggles are real, and we do have mental health providers at all of our clinics. So I want to make sure that you understand that telehealth can be done through, mental health care can be done through telehealth. And you can connect with somebody who's there to help you if you are struggling with depression or anxiety or other mental health issues around this time. And then finally, I just want to point out that there is a rise in sexually transmitted diseases in our county and in the state. I think that people are not going to get the care that they normally would get because they're afraid of the COVID situation at our clinics. So if you have any symptoms or risk or concerns for a possible sexually transmitted disease, I would just ask that you not hesitate to get the care that you need. We are seeing serious complications from things that are highly treatable that we should really, like in my 20-year career as a physician, I've never seen until now. So please don't hesitate to see a doctor. If on a telehealth visit, the doctor decides that you do need to come in for some reason, then I do want you to know that we take all safety measures at our clinics. Patients are all screened prior to coming into the building. They're screened by checking their temperatures, asking questions, and even prior to the visit to make sure that everyone is safe when they do come in. So those are the steps that we are taking to make sure that when you do need to come into the office, that you will do so in a safe way and still get the care that you need. All right, thank you. I am honored to introduce Dr. John Fankhauser. He is my counterpart and CEO at the Ventura County Hospitals, and he's next to take on the podium. I'm going to take a second to hopefully do as good a job as Rigo at cleaning this little podium up, though. Hold on just a minute. Okay.
Thank you, Dr. Cho. My name is John Fankhauser, and I am, as Dr. Cho mentioned, the CEO of our two county hospitals, VCMC and Santa Paula Hospital. And I'm once again honored to get a chance to just share with you an update of what's going on at the hospital, some of the new measures that are being implemented there, and some of our concerns that we would just welcome the opportunity to share with you today. One of the biggest initiatives at our hospital is something that the state has recommended, which is weekly testing of all hospital-based healthcare personnel. So we are rolling that out this week. What we do know is that will significantly reduce the risk of transmission, particularly from asymptomatic individuals in our system, by as much as 30%. As I mentioned in last week, 2 days prior to you feeling ill, when you have COVID, you are contagious. So you can be spreading the virus to your family members, to your friends, to those who you interact with in the community for 2 days prior to ever feeling the least bit ill. And that can happen in the workplace as well. So we're really looking to catch those individuals prior to exposing other folks in the workplace. I think recognizing that healthcare workers are really at a unique risk or in a unique risk group, about 8 times the risk of the general community, healthcare workers are exposed to patients who are feeling ill and have COVID. And as you have seen in the news, multiple nurses and doctors over this last few months have died of this illness. We just saw the report last week of an otherwise healthy 51-year-old ICU doctor who died of COVID after having cared for COVID patients for many months. And we all recognize the risk that our healthcare workers are taking. One of the wonderful things on the horizon is the access to the vaccine. As Rigo mentioned, we anticipate receiving the vaccine from Pfizer sometime in the next week or two, and we are prepared to begin vaccinating our staff. I know there's been a lot of talk out there, really what I would call conspiracy theory talk about the vaccine, people who are fearful of the vaccine, and I think it's reassuring to know that the vast majority of doctors at our hospital we polled them, and they're expressing their intent to receive the vaccine as soon as it's available. I know that I certainly will. And I just want to encourage you, if you haven't listened to our health officer, Dr. Robert Levin's presentation on vaccine hesitancy in the community. I believe it will be posted on our social media site, but he gave just a tremendous presentation yesterday in the Board of Supervisors meeting, and I just thought it was remarkable just to reflect on the number of organizations that have to approve of these vaccines before they're released, including, of course, the FDA, but also the American Medical Association, the Advisory Council on Immunization Practices, the American Nurses Association, American Hospital Association, and the National Academy of Sciences, all of whom have no financial interest in moving this vaccine forward and are have been charged for many, many years with protecting us from healthcare threats. I wanted to share a little bit about the hospital capacity. As Rigo mentioned, we are beginning to see that our capacity, we're bumping up against capacity issues in our hospital, oftentimes not just related to bed space, but also related to staffing. As staff become ill or out on leave, and as staff demands for travelers and registry staff grows throughout the United States in every community, it's more and more challenging to staff hospital beds. And in that context, we've seen a significant uptick in hospital beds. So I think if you could move to the column graph here. I just want you to take a look at this graph. And I know for a lot of folks, seeing graphs and numbers doesn't really make an impact. So I want to walk through this with you. 4 weeks ago, there were 35 patients with COVID in our hospitals in Ventura County. 4 weeks ago. That's the bar on the far left, November 10th. And as you see, every day since then, with the exception of 2 or 3 days, there has been an increase in numbers of hospitalized patients with COVID in our county. As Rigo mentioned, today we're up to 147 patients in our county, and 42 of those are in the ICU. At Ventura County Medical Center and Santa Paula Hospital, we have that same experience. We're seeing increasing numbers just about every day. And again, just this week, again, I heard it referred to as a disease of the elderly. And you know, I have friends and family members who are elderly, and I in no way want to discount the importance of controlling an illness that affects our elderly. That's a critically important thing for our society. But this is an illness that can affect all of us. In our hospital right now, 40% of our patients are under the age of 50. We have a teenager. We have someone in their 20s. The sense of invulnerability that I see in young people is really just, again, wrong-minded thinking. And we need you to take precautions, because this disease can become severe for people of any age group. we know how to control it. It's not a mystery. You've heard it multiple times, but we continue to see people coming into the hospital telling stories of gathering around food in homes or elsewhere in groups of 5, 10, 15, from 2, 3, 4 households. That's how this disease is spread. We see people around potlucks in the workplace sharing, food and dropping their masks to eat. And we know that's how this disease is spread. So I just, again, want to urge you, use masks, social distance, stand well away from someone. If you're outdoors and you have to be within 6 feet of someone else, wear a mask. Avoid gatherings that involve multiple family groups or members of multiple homes. And wash hands, use hand sanitizer as often as possible. We controlled this in the spring. We know how to do this. What we're seeing in the community is kind of people getting fatigued, tiring of these precautions. But it's critical. Look at these numbers. Today we have capacity. If you come into our emergency room today, you need an ICU bed, you need to be hospitalized, you need surgery. We have that capacity. We are taking all of the measures to improve that capacity that we can possibly take. We've even reduced our elective surgeries. But if you look at that trend, 3 to 4 weeks from now, that will be beyond the capacity of any of our hospitals in Ventura County. And we cannot be there. It's just critically important for us to turn the tide now. We can't continue to do what we're doing now and just expect that miraculously this disease will go away. It won't. I also just want to, if the next slide, if you just introduce you to something that's coming out tomorrow from the state. If you go onto the site, covid19.ca.gov, you will see this Cal Notify app, and tomorrow it will be available to all of us to download onto our cell phones. And this is really a way to enhance contact tracing. And we will be able to take anonymously, without disclosing anyone's identity, individuals who've contracted COVID and be able to notify those who've come near that individual and have the potential to be exposed. So just encourage all of you today, you can go and get a little more detail. Tomorrow you can actually download the app. Encourage all of you to go to covid19.ca.gov and get that app that the state is making available for free. With that, I would just like to take the chance to introduce our county CEO, Mike Powers, and again want to thank you for the chance to talk with you today.
Well, good afternoon. Thank you, Dr. Fankhauser. So powerful to hear from the excellent leaders of our county hospital and clinic system. And I think you could hear from Dr. Fankhauser the situation our community is facing with these rising cases. But we know what to do about it, and we can see that you're taking action by getting tested, and we really appreciate you continuing to do that because as you see these numbers, we have to stem that tide. And we appreciate all that you're doing. Also important what Dr. Cho said. It was really striking to hear the drop in the numbers of preventive care visits. That is so important that we hear that message while all this is going on. It's such an important part of our community's health and each individual family's health is taking care of those preventive visits that can stop things in their tracks. As we're battling this virus on multiple fronts, and will continue to. We also heard, as we heard from Chair Long and our board yesterday, the efforts to move forward with a Central Coast regional approach. And I wanted to just echo a few things that have been said about that. First, thank the Board of Supervisors from our county, of course, and also Santa Barbara and San Luis Obispo counties, because all three boards voted unanimously in support of sending this letter to the governor, as well as our public health leadership, who work so well together. They are united in this request from a public health standpoint. And it just makes sense. I mean, this region is by far the largest. It's got 23 million people in it out of 40 million in the state. Our proposed region would have 1.5 million. We think that makes more sense demographically, geographically. It just makes much more sense for us to be combined together. And I wanted to clarify a couple of points that have been raised, very understandable. In fact, yesterday at a press conference, I think the state health director, Dr. Gawley, was asked about this, and he said about this request, and he said that they would not be granting the request at this time. And I think those words are important, because he said not at this time. He didn't close the door to it. And I think that's important too, because we're not really requesting it at this time. We're requesting it if in 3 weeks our numbers are looking good. That would be the first opportunity we would have to exit this large Southern California region and exit the regional stay-at-home order. So that's when we would request it. And it's really just the starting of a dialogue with the state. And we're still facing the surge here locally, so we're focused on that as well. But this is starting a dialogue with the state, and we want you to know that the state has been very responsive to us when we've asked to engage with them on these important issues. And so we expect to continue to be able to have that good partnership and engagement with the state to discuss these issues. Also, another comment that the State Director of Health made was that even if there were some changes in the delineations of the boundaries, that very likely most of the region would continue to stay in a regional stay-at-home order. And we agree with that statement. And it's really kind of our point of this, which is right now, in fact, if we look at the data, our ICU capacity, we would not be under this Southern California regional stay-at-home order if we were our own tri-county region. So I think it just shows the impact, because what we want to avoid is preventable economic and educational hardship to our community. And we really feel like this tri-county region would help us do that, while we are at the same time, of course, battling this virus on multiple fronts. And we heard Dr. Fankhauser talk about hospital capacity, and that is so important. I also wanted to touch on a point that's been raised about that, or some questions, very understandable questions. What impact would a region like this have on hospital capacity? And it doesn't affect that at all. There is in place, it's called Local Emergency Medical Services Agency, that's set up by the state, and it's operated locally here, part of our public health department. They are the ones, and here it's Steve Carroll, Director of our Emergency Medical Services Agency, that coordinate hospital capacity. So were individual hospitals to need shared capacity here within our county, they would coordinate that. And if we need to go outside of our county, they would also coordinate that. This agency would, both with hospitals up north and to the south. It's a very organized, well-thought-out system that's been in place for decades. They coordinate regularly, and we just want to assure the public that there is a very strong system in place to ensure adequate hospital capacity. We also want to let folks know that the hospitals right now, in terms of their surge capacity, they're nowhere near using their full surge capacity. So we just want to reassure folks. At the same time, we do see that troubling trend, and if that trend continues, that's really going to impact that surge capacity, and that's why we have to get a hold of this surge and stop it. But there is strong surge capacity, and it is truly a strain on our health systems, as we know, and the staff members who've been doing this. But I also really want to compliment them, because as I heard from our EMS agency director this morning, he said it's really amazing the number of COVID patients in the hospital now are higher than it was when we were in the summer at 102. Now it's at 147. But the hospitals seem to be doing actually a better job now of handling those cases. I think it's the preparation, it's the experience, it's the skill sets that they have, And I just really want to compliment the wonderful work they're doing, all of our local hospitals. And I tell you, whenever we need to coordinate something, we have a question, they all jump on, all the CEOs of the hospital, Dr. Fank, and all the other hospitals get on instantly. And I just think the public would be really reassured to know how on it and coordinated and collaborative these hospital leaders are throughout our county. And so it's a big part of our strength here of our health system. Testing, as we know, is a big part of our efforts to stop the spread here. And one of the things that we've talked about before is we've been testing at a pretty extraordinary rate. That's really straining capacity. And as we've seen lately, we've had some bumps in our ability to provide that testing. A couple of reasons. One, the extreme wind conditions that we've had, but also there's been breakdowns in the supply chain that are really outside of our control. That doesn't mean we're not looking for other resources to address that. We are. I just want you to know that. But there's issues with our lab. Some of the shipments have been sent to other states, in fact. Some are held up at customs. I'll spare you all the details. Just suffice to say there's a lot of logistics involved. But we are looking for other resources to get tests and available. And so because of those other efforts, the team being very resourceful, they are going to have enough tests to be able to reopen sites today at 2 o'clock at Oxnard College as well as Moore Park College. So they'll be open from 2 to 7. The fairgrounds are closed every Wednesday, but they are going to be open as usual 6 days a week. So a lot going on in the testing area, and we know that because of some of these challenges, also results are being delayed, and we know that's very troubling from a tracing standpoint, from individuals who are anxious to get their test standpoint. We just heard from the CEO of Healthvana, the company that manages that information, who apologized. He said there's some things that are outside of their hands in terms of the outside lab's ability to process the test. So it is a challenge. It's not an excuse. We just want you to be aware of it, but that our team is on it, and we're working on it, and we're working on stabilizing this supply chain and the results reporting in the short term and the long term. So we are on it. We're completely dedicated to it, and we're throwing all of the resources that we have available to addressing it. But in the meantime, we thank you for your patience, continuing to get tested, and continuing to look at our website, VenturaCountyRecovers.org, because we have updated information, it seems like every 10 minutes or so as things change. So please do stay connected on that website. Business support, we touched on it yesterday at our board, and with our board support and their careful thoughtful budgeting, we are going to be able to ensure that we use all of our federal CARES money, but also free up some of our local tax dollars to be able to support a business assistance program likely that will be coming in the first months, January, February of the new year. Also, the state has announced some programs, some tax extension programs and business assistance program, business grant programs. I really encourage you to work with our Economic Development Collaborative. They are amazing at being able to translate what those state programs actually mean and how you as an individual business can access them. So they're a great resource. Our FAQs on our site. And again, we encourage you to stay updated on our FAQs because they change regularly. One of the great pieces of information we got today is that per the state, playgrounds can now stay open at parks and schools, and boy, is that important. And so really important information to continue to share. While all of this is going on, of course, the other work of our first responders is happening, and with this wind condition, not only affected our testing, but we had not one but 2 fires. And great response by our first responders on both. The Santa Paula fire, that was actually identified with a new high-tech program with our sheriff's dispatch system. Their remote cameras spotted it instantly, and we're able to share that information with our wonderful firefighters, and that helped them jump on it very quickly and contain it. And that was great. And then just yesterday afternoon, we had another fire in Ventura, and our wonderful firefighters jumped on that as well and stopped it in its tracks. And also our county and city partners worked with some of the homeless population that needed resources there as well. So again, there's a lot of things going on, of course, and so we appreciate you staying connected. VC Alert is another great way. I think Chair Long mentioned that. Register at 313131 to register. Text VC Alert. So please, so many more of you are connected, and I think that's great. Stay engaged with us. That feedback that you give us is really important, and we do listen and we do act on it. So Ventura County, thank you for hanging in there. I know we're in a tough time right now, but you're doing everything that you can, and we appreciate it. And please take care, and we will be in touch with you soon. Thank you.